whenever you tackle something like this, collaboration is of the essence, right? And that's why we're so proud to partner with the Forum, with Us Against Alzheimer's, with the Alzheimer's Davos Collaborative, and so many others, because there's a real case for change here, right? And that's what we've been very focused on, is the business case around this. Yes, we love numbers, but we love change even more. And part of having these numbers is about enabling that positive, enduring change, right? The big number, $26 trillion of economic opportunity from addressing brain health. And close to 12 trillion of that tied to what employers can do about promoting healthy workforces, right? But let's admit it, it can be quite challenging for employers because we've been looking at brain health in very siloed ways, right? In terms of what exactly do we mean by this? And one of the things, and I know I have a slide, and people say McKinsey in the slides with too many slides, promise just one, but we're super proud of this work that's a result of the collaboration with Us Against Alzheimer's and the Davos Alzheimer's Collaborative. That's looking at the intersection, because that's what we need. We need to think about how we bring these elements together, right? In the center, you see the three elements that when you're looking at it from an employer perspective, is how we define brain health, right? It is basically, and I make sure I get them in the right order, yes, mental health, right? It's neurological health, and it's workforce productivity. And for too long, we've been looking at these elements almost one by one. What are the solutions for each of them? And no wonder employers, lots of good intent, but it can get really overwhelming, right? And so what this work has done is like, let's look at over 80 risk and resilience factors and help prioritize, help bring focus to which are the ones that really impact even more. If you have to put disproportionate energy behind them, which are those? And those are the 9 that you see behind me, right? None of this will surprise you, right? But it is trying to give some more clarity to, out of those many that exist, where to focus on. Sleep, stress, right? Again, no surprises, but most importantly, how do you connect it to the business value drivers, right? What does it take to get to that 26 trillion that I was speaking about, right? And that's when you start thinking about, okay, this impacts how I attract talent, right? How I develop talent, the productivity of my talent. And so, well, this framework at this point is not yet quantified. That's, the next piece of work that needs to be done to assign specific numbers, percentages to these boxes. I still believe it does a really, hopefully brings that clarity to the criticality of intersectionality in how we think about this space and how we have to connect the dots, right? So that we know the interventions that we're doing on this risk and resilience factors, how do they enable those positive outputs that we see on the other end of the slide? So only if we tie this all together will we unlock that productivity and well-being that we so desperately need. I mean, change is the name of the game, right? And building that adaptability and resilience that George was speaking about is only possible by focusing on brain skills and brain health. So